Welcome to another episode of Weight Loss with Dr. A.
Hello everyone and welcome to another episode of Weight Loss with Dr. A. I'm Dr. Alvarez with Endobariatric.com, and on this podcast, on this episode, I wanted to address a concern most patients have, which is gallbladder issues. Now, it's important for patients to understand that having gallbladder issues, well, let me tell you this, vast majority of the population, of course, don't have gallbladder issues throughout their lives. There is a percentage of patients that throughout their lives may have gallbladder problems. Now, if you are obese, this percentage is increased. You are more prone to have gallbladder issues. Why? Because there's normally more cholesterol. There's normally more concentration of this pigment in your bile, and produces or favors the production of gallstones. The other thing is, being obese is also known to have a related circumstance with having gallbladders. If you have a larger gallbladder, imagine yourself a gallbladder is like a balloon. All right, you have a larger balloon. Now that balloon normally holds bile. This bile is concentrated there, and whenever you eat high protein or fat food, it triggers the gallbladder to actually release the bile into your first portion of your intestine and help it digest. Well, that's the function of the gallbladder. By the way, human beings have the ability to actually live without the gallbladder without any issues. So if you have a larger balloon, because in this situation is that if you're obese, you have a larger gallbladder, you have a larger balloon there. So when it is triggered to actually empty, when it receives this signal to empty the gallbladder, it may not be enough to actually empty it completely, and you may have some residue there. This residue, with time, it may precipitate to actually some sludge, and it may continue with some time to form the gallstones. So, just by being obese, you are more prone to have gallbladder problems. Sometimes I get this from patients, and patients are actually worried of having gallbladder problems down the road, and sometimes it makes their decision to have weight loss surgery stall. Hold on there, hold your horses. I'm not going to have weight loss surgery because I've heard, or I researched online, or I Googled it, that some patients may have gallbladder issues down the road. And listen, these patients actually, they actually hold from taking that step. They actually stop right there on their tracks to actually be able to proceed and have weight loss surgery and get better all around, get better with their health, get better with their quality of life, get better with their lifespan, and they actually make it a decision point of having weight loss surgery or not, just because they're thinking of their gallbladder. So that's what I'm here to talk to you about on this podcast. Now, let me give you some statistics here. A third of patients having weight loss surgery may have issues with their gallbladder down the road. That means 1 out of 3. All right. So please don't make it a decision factor. Let me tell you why. If you have the misfortune of actually developing gallstones down the road, this is taken care of with a simple laparoscopic procedure to remove your gallbladder and your gallstones. Now, you need to remove not only the gallstones, but also your gallbladder. Because the gallbladder is it's the organ that is malfunctioning, if you want to see it that way. And since it's malfunctioning, it is not emptying correctly. It is forming this sludge, which then precipitates and then forms the gallstones. So it's not just going in and removing the gallstones. It is important to remove the organ, the gallbladder, and it goes along with the gallstones. Remember, I just mentioned human beings have the ability to actually live without the gallbladder without any issues whatsoever. So you won't have any issues down the road not having your gallbladder, and you will just set it apart. You took that gallbladder out. You're on your way, and you won't have any issues with it down the road. So it is important for you to understand that there are some factors related to weight loss surgery that makes you more prone to have gallbladder problems. And the most important one is rapid weight loss. It doesn't matter if it's with weight loss surgery. If you get on track on this weight loss program, you're exercising, you're watching what you're doing, you're really putting in a lot of effort to lose weight, and you're like killing it. You're crushing it. You're losing weight greatly with weight loss surgery, without weight loss surgery. This may precipitate the formation of gallstones. Okay, so it's not actually just weight loss surgery per se, or because you had surgery itself. You can get the gallstones with rapid weight loss. All right, now weight loss surgery per se is rapid weight loss because you're going to go really quick with the weight loss. Will you get the gallstones? I really don't know. 1 out of 3 will. Is there a way to prevent this? Well, here goes. There is one medication called AskDrA. This medication is given out normally to weight loss surgery patients that are malabsorption procedures. Gastric bypass patients, duodenal switch patients. Now, this medication, number one, it's expensive. It's an expensive medication. The other thing is that I in particular don't like is that if you sooner or later you gotta be off that medication. You can't be taking it for the rest of your life. So sometimes patients take for a year or 2 years. When you stop taking the medication, guess what? Vast majority of the patients that were prone to have gallbladder problems develop the gallstones at that point. So what I like to tell my patients is, listen, relax, live life, all right? Gastric sleeve patients don't develop gallstones as much or as frequent as duodenal switch or gastric bypass patients. And if, and only if, you live life, make good healthy choices, get your good exercises, and if and only if down the road you are diagnosed with gallbladder problems, well, get surgery. A general surgeon back home, or it's something that we do here as well. It's a simple laparoscopic procedure that we remove the gallbladder along with the gallstones, and that is that. You continue living your life to the fullest, but you're enjoying the weight loss, all right? Please don't make it a decision factor to not proceed to get weight loss surgery, because it is important for you to get the most out of life, to get the most out of quality of life, to get the most out of lifespan, and help all around your body to work better with a more adequate weight altogether. Now, gallstones, you may be thinking, well, what happens? How do I really know if I really do have gallstones? Because I've heard, because I read, because I think I might have some. Well, gallbladder issues are a series of symptoms, and vast majority of the patients are related to GI symptoms. They're practically all gastrointestinal symptoms, and they're practically all related to ingestion of food. And after the ingestion, specifically of high-fat food, they normally trigger the gallbladder to actually hurt and spasm. And some patients may have some pain in the epigastrium, which is up here, and sometimes radiated to the right side, to where the gallbladder is. And sometimes it's related. Some patients actually say it's like a belt pain, like goes in belt even toward the back. It is sometimes accompanied with nausea, vomiting, bloating, uncomfortable sensation, and these are typical symptoms of the gallbladder. So if you do have some of these symptoms, what should I do? What can I do about it? Go to your doctor. Your doctor, the best test to actually get your gallbladder checked out is an ultrasound. So get an ultrasound done and check that gallbladder out. Now, gallstones per se are not the only pathology or the only problem a gallbladder can develop. The gallbladder can develop gallstones, it can develop sludge, and sometimes the sludge is symptomatic. It is required to get that gallbladder out. The other situation is sometimes polyps. Now, polyps is a situation, a little artifact in the inner mucosa of the gallbladder that is a precursor of malignancy. Sometimes just the size of that polyp inside the gallbladder is a good indication to get it removed. So all these situations you don't need to know about, of course. All you need to do is, if you do have these symptoms, get it checked with your doctor. Your doctor will pick up from there, and they will let you know if you need gallbladder surgery or if not. I want to make a big parenthesis here, because I hear it a lot on social media, on some boards, on some weight loss surgery community boards online, Facebook groups. I've seen people suggest a certain type of diet, paleo diet, keto diet, vegan diet, to actually make the gallstones go away. Will it work? No, it will not. So please don't be blind and fooled by these statements, all right? If you have gallstones, people, best advice is get them removed surgically along with your gallbladder. But doctor, I've heard if I do take some ginger capsules or turmeric or whatever, they will go away. No, they will not, all right? So if you already have the gallstones, if your doctor diagnosed this with an ultrasound and you have it already documented, avoid yourself a problem. What happens if I just keep going? What happens is I refuse to have surgery, I just keep the gallstones there? It may give you serious problems down the road. The best time to get the gallbladder removed along with the gallstones is at the time of diagnosis, with problems or avoiding this situation with the gallstones and gallbladder to actually give you problems down the road, like pancreatitis. Now, pancreatitis is a very common complication of having gallstones. Pancreatitis can go from mild to severe and put you in the ICU unit and sometimes kill some people. So my best advice is, if you have the gallstones, if you're worried, I would be more worried of having them there than having them removed. Okay, so that's my best advice. I hope I cleared out some myths regarding weight loss surgery and gallbladder issues. Some myths actually just about the gallbladder, And that's what I'm here for. So if you have any specific topics, you can let us know via social media, and I'll be glad to have them here on Weight Loss with Dr. A, the podcast. Thanks so much, and I'll see you in the next episode.